Hello, everyone. So, what can you do to take better care of your diabetes? This is part three. For those who tune for the first time, I'm Dr. Francisco. I'm a specialist nephrologist and a transplant immunologist working at Francisco Kidney and Medical Center in Singapore. Welcome to the bite-sized information for kidney diseases and related diseases like type 2 diabetes. This video blog is destined to help patients with kidney problems or risk of kidney problems or their relatives, including patients with diabetes, to be better informed so they can take better control of their disease, minimizing worries, and to take better decisions with their own doctor or with me if they choose me, and as a consequence, minimizing complications. So this is part three of what can you do to take better care of your diabetes. So this is tip number 8. It's not typically associated with blood sugar or anything like that, but is avoid very salty food, especially if you have high blood pressure. This will protect your heart, protect your cardiovascular system, your blood vessels, and also can prevent some fluid retention. But why? Not all the advice that people need that it relates to diet or doing exercise or improving the sugar, but to improving everything that might be deranged, everything that might be off scale. As I have mentioned in previous videos, diabetes is a disease of the blood vessels. The blood sugar go and caramelize around, sort of caramelize around the blood vessels and affects them in their function, make them stiffer. For that reason, it can affect many organs that are rich on blood vessels and depend on well functioning of the vascular system, like the heart, the eyes, the brain, the kidneys, the circulation to the legs, etc. So when you have diabetes, yes, you need to control your sugar, your diet, improve your lifestyle, more active, etc. But control is very important to control any other risk factor or improve any other things that might be a little bit deranged in your diet. Like if you eat a lot of salt, minimize it, and so on. So I will be giving you some extra advice. Remember, it's not controlling kidney problem, it's not controlling diabetes, it's improving your health overall, minimizing your risk overall, not treating a disease with just a medication. It's treating your whole self, improving your whole self, planning a lifestyle strategy so you can get the best out of it. We should move out of just treating the disease, just go up to the doctor and give you medication and then go, or just the solution is a medication, increasing medication, new medications, etc. No, or just, okay, you are just my doctor for the kidney, just focus on the kidney. No, we need to treat ourselves, manage ourselves holistically, and as a doctors, healthcare providers in whatever specialty or discipline, we should see our patients in a holistic way, try to improve their health overall. So that's why this advice goes to improve other things that might be deranged, not necessarily just your blood sugar. Okay, number 9, aim to have a blood pressure of at least, this varies depending on guidelines, depending on people, depending on doctors, programs, hospitals, etc. But at least has to be less than 140 or 90 millimeters of mercury. Some people, if it's less than 135 or 130, people have said that less than 25 is much better. Yes, a little bit the lower, the better. But if you need to go into such a lower blood pressure, expenses of taking so many medications with potential effects or with the risk of lowering the blood pressure and feeling dizzy, falling, then is a different story. So it has to be a balance. Yes, the best achievable blood pressure with medications or with diet or lifestyle, without really giving you extra risk and you feeling, those side effects, is ideal. But definitely, it is ideal to be less than 140/90. If can be less than 130 over 85, 80 is probably a little more benefit. But if just getting 100/50, you're going to feel be better. No, if it is a good blood pressure on your own, you don't need medications, it's okay. But you don't need to target also a very low blood pressure and then have side effects of, potentially feeling dizzy and having a fall hitting your head, etc. No, so it has to be a balance. Discuss with your doctor. For every patient is different, so but definitely try not to go beyond 140/90 most of the time. One time, maybe you were a little bit stressed, you were rushing, etc. Nothing happens. But like the rule throughout your life days is not more than that. If so, you might need an extra top of medications or improve your intake on salt, as I mentioned before. Talk to your doctor. You can talk to me as well. In relation to this, the number 10 advice is to buy a blood pressure machine to monitor your blood pressure at home, because then the blood pressure is very important because it's protecting your cardiovascular system, and the cardiovascular system is already affected by diabetes. You don't want to have that injury together. It's very important also if you buy the blood pressure machine because you monitor at home, because you are living at home, you're not living in a hospital. So you probably see the doctor every 3 months, every 6 months, I don't know, depending on your condition and the program you are on. But imagine if you go to the doctor in 3 months, 6 months, and they discover the blood pressure is high, then the doctor give you medications, but maybe the blood pressure has been high for the last 3 or 6 months, when probably if you would have monitored at home, you could have discovered and act on it and prevent damage to your cardiovascular system. So that's one of the beauties. Also, the other thing is to detect what we call white coat hypertension, like some people is a little bit of stress in the doctor discussing all these serious matters, etc. So the blood pressure goes high in the clinic, but at home, when they are normally, most of the time, the blood pressure is okay. So by having this monitor at home, you can discover that. Say, doc, at home my blood pressure is okay. So the doctor will tell you maybe we don't need to do anything, no? If it's just high because you are stressed, he has seen me talking about very important things. And also, you buy a machine, your family, the rest of your family can also use it to monitor blood pressure. So it's a good investment. It's not that expensive. Any blood pressure machine will be good. You don't need to go for the high tech ones. So it can give you a good idea. So just consider investing in a blood pressure machine. And sometimes, especially when the blood pressure is messy, you want to know exactly how it's at home, because, yes, the doctor will take the decision on the blood pressure on the clinic, but they don't know how it's at home. Sometimes medications need to be dosed according to the daytime. Sometimes the blood pressure goes high in the night so sometimes the medications can be dosed twice a day, or a higher dose in the morning or in the evening, etc. Knowing how the blood pressure is doing at home, it is very important. So that's one of the things that can help the doctors to take a more targeted decision, and not just based on one-off in the clinic, just being this reading, but at home is probably better, or at home is actually worse, or maybe the medication has to be dosed differently. Sometimes by dosing differently throughout the day, the medications the blood pressure can be more stable. So that's one of the beauties and the benefits you can obtain by you monitor the blood pressure, and not just one reading once in a while. Just when everything is stable, yes, you can even do it once a week, etc. But when you are trying to target the medication and discover, so for a couple of days or a few days to try to monitor more closely to get a pattern is very useful for doctors, especially when someone has got kidney problems with more labeled high blood pressure, etc. That gives us a lot of intel to how to dose the medications better, to improve it better, but also to minimize side effects, like sometimes the blood pressure overshoots and goes lower than we want. So I think it's 10 minutes. Should we stop now? Let's just give you 2 more related to the kidneys, 2 more tips. um, get your kidney function checked, and test for leakage of protein in the urine, no? Because one of the common side effects, around 40% of patients also have diabetic kidney disease, and to different degrees. A significant proportion develop advanced kidney disease, a significant proportion develop kidney failure, although, it might be a small percentage of the whole population of diabetic patients. Those who develop advanced kidney disease or kidney failure really have a huge struggle in their lives, with their well-being and their health affected, even the lifespan minimized, with lots of complications, lots of costs, etc. It's something that you want to avoid, but at least you want to recognize early so that you can start managing better with medications or with lifestyle. Sometimes lifestyle is very impactful, as I already preach it, and I don't preach it just for fun. I just preach it because it's meaningful, and I have seen the difference. The people who change their lifestyle, change their diet, compared to people who just accept medications and increase in doses. I've seen the difference. They tend to live better and longer than the people that just, when the problem start getting worse, just adding more medications. But because that means the root of the problem has not been treated, and just waiting for complications. Yeah. So basically how diabetic kidney disease is expressed in your body is by kidney dysfunction that is already a late event, or by leakage of protein in the kidney. So you have that, so can flag to your doctor that your kidneys are already struggling and maybe need some more strong strategy on medications or lifestyle, blood pressure control, sugar control, etc. And you can also open your mind and your eyes to a better self-care as well. And so remember, consult your doctor to see if you need to be checked for diabetic kidney disease. Typically, diabetic patients are monitored for kidney function and protein leakage in the urine. No? And if you have protein leakage in the urine, ask your doctor if you should use those antiproteinuric medications, as they can protect your kidney. These antiproteinuric medications are blood pressure tablets that also have an effect by reducing the blood pressure at the microscopic level in the kidneys, and therefore has a reduction of the protein leakage in the kidneys, minimizing further damage to the kidneys. Unfortunately, not everyone can use them. There are some contraindications, and some people might have some side effect, but discuss that with your doctor. The secret at the end of the day is there's no obvious allergy or anything. It's just to try and monitor to be sure that there is no side effect. Typical side effects are they can increase the potassium, or they can increase the creatinine. So, but there is some certain levels of tolerability. If it's too much, then the medication might need to be reduced or stopped. But a little bit of incremental creatinine, even some people say that if the creatinine increases, means the medication is working. So, but that is personalized. But indeed, if you have protein leakage in the urine, consider or discuss with your doctor if you should be on antiproteinuric medications. Yeah. But as I repeat, not everyone is suitable. So in Francisco Kidney Medical Center and in my other company, we focus in diet and lifestyle, etc. But not only on that, we focus in every single little aspect of your metabolism, your other conditions, blood pressure, cholesterol, high uric acid, that can be deranged, because it's those little changes, those little improvements in every single little aspect, like eventually we can compound of high benefit, because it's the opposite. Those not so good things in this aspect of blood pressure, in sugar control, in uric acid, in cholesterol, in also smoke, etc. All that the compounding of that is what eventually causes disease and complications. So now we need to do the opposite, try to improve whatever you identify that is not so good. And that's what we do in my companies, focusing on disease prevention and the prevention of complications, because it's more impactful. It creates more benefits, it's cheaper, it's less stressing, and eventually you can guarantee you to live a better and longer life compared to just continue the same. So, because at the end, our focus is your health as a whole, as a person, not just focusing on a disease. Anyone can treat disease, but anyone can give you a medication, a particular medication. Every doctor can prescribe it. That's not the focus is identifying what other things are, how else we can help you to get a more rounded health, to get a more rounded minimization of risk and prevention. That's what we do here. And one of the strategies is education. So that's why I have created this group. Sometimes I talk a lot of serious things. Sometimes I talk things that you might not quite like it. Oh, he's telling me to change this. Like, if it is so simple, I don't understand. It's not simple, but it's so impactful if you can do it. But sometimes it's just my matter of changing how we think to be able to accept those changes. Sometimes it's just matter to say, yes, that's the best thing that I can do, or should I, the thing I should do to try to live better and longer. So for that reason, I should welcome it and be happy to make that change in my life, no? So if you need my help, you know how to contact me. We continue next week part 4 of these tips to try to minimize complications of diabetes, to take better care of patients who have diabetes, to try to prevent those other diseases like diabetic kidney disease, kidney problems, kidney failure, or other complications like blindness, strokes, heart attacks, etc. Or if fortunately you have one, not to have the second one. So if you have any comment, please, you can ask now. If not, just leave it in the replay. If you like this, if you think it's helping you, giving you advice, just give your thumbs up, share with some friends, peers that have diabetes, some struggle. It certainly will be beneficial. Knowing what ideally we should do is beneficial, so this can motivate us to do a change. And every change that is positive, definitely there will be a positive impact in your health and in your body. You might not feel it, you might not see it, you might not even believe it, but you just need to trust that it will happen, because it happens, no? But just please give me some, share the existence of this group, give me some thumbs up, and try to be interactive. Otherwise, it becomes a monologue, and the aim is to be interactive, so I can give you the best possible advice, and I can clarify some things. But please press like, so at least I know that what I'm doing, what I'm saying, the time, effort spent on all this is meaningful and is at least benefiting someone. Otherwise, if I don't have a reaction from you, it's very difficult to gauge that. So I'm Dr. Francisco, wishing you the best possible health. Take care. Bye.